Have you been wondering how and when to introduce peanuts and tree nuts to your baby? In this video, I'm going to talk about the safe ways to offer these potentially allergenic foods and the best age to introduce peanut and tree nut products to your baby. If this is our first time meeting, I'm Dr. Belousov. I'm a board-certified pediatrician and I equip parents with knowledge so they can care for their children with confidence. Many parents are nervous about introducing the common allergenic foods to their baby, especially peanuts, because of fear of an allergic reaction. I put together this video series to show you how simple it is to introduce these foods and to make you aware of the health benefits of introducing the allergenic foods early and often. This is the second video in the food allergy series. I'll have the other ones linked at the end of this video once they're released. Starting off, let's talk about what age you should begin introducing peanut and tree nut products to your baby. For many years, parents were advised to avoid exposing their child to the common allergenic foods in their first several years of life. However, more recent studies have shown that delaying the introduction of the common allergenic foods can increase a baby's risk of developing allergies to these foods. The Learning Early About Peanut Allergy or LEAP study showed that early introduction of peanut to babies at risk for peanut allergy reduced their chances of developing a peanut allergy by 80%. According to the study, babies who were considered high risk for peanut allergy were those who had severe persistent eczema and/or a diagnosis of egg allergy. It was found that these babies would benefit from the introduction of peanut-containing foods as early as 4 to 6 months. But before introducing a peanut product, it's recommended that babies who are considered high risk for peanut allergy have an allergy evaluation or allergy testing. So if this is the case for your child, speak with your child's healthcare provider between the ages of 2 to 4 months regarding a plan for how and when you should introduce peanut products. And if the test comes back positive for a peanut allergy, you will most likely be advised to do the initial introduction in the supervised setting of a medical office. Babies with mild to moderate eczema are also at a slightly increased risk of developing peanut allergy. They should be introduced to peanut-containing products around 6 months of age and continue to be exposed to peanut-containing products regularly. These infants don't need to have allergy testing and may have peanut product introduced at home. Although tree nut allergy has been less studied than peanut allergy, the risk factors are believed to be similar to those of peanut allergy. Of tree nut allergies, walnut allergy is most common, followed by cashew, almond, pecan, and pistachio. Allergies to hazelnut, pine nut, and macadamia are even less frequent. Tree nut products can be introduced as early as 6 months of age. After introducing your child to several low allergy foods, you can begin to offer the common allergenic foods to your baby one at a time, even in the first week of starting solids. There's no reason to delay exposing your baby to peanut and tree nut products early on in the food introduction process. It's to the baby's benefit to eat them early and to continue to eat them often as a strategy to lower your child's risk of developing an allergy to these foods. Now let's talk about how you can safely introduce peanuts and tree nuts to your baby. Pick a good time in the morning or afternoon to introduce the new allergenic food. This way, you give yourself several hours of awake time to observe for a potential allergic reaction. Avoid giving 2 new foods on the same day. That way, in the event that your child has an allergic reaction, it won't be confusing which one was the cause. When introducing peanut or tree nut for the first time, out of an abundance of caution, it's recommended to spend several days giving the new allergenic food and holding off on offering any other new foods during those days. However, it's fine to bring back foods that your baby had previously and did well with. Whole nuts are choking hazards and should not be fed to babies or toddlers. If whole or partially chewed nuts are accidentally breathed into the lungs, they can block the airways. It's best to avoid giving whole peanuts or nuts to your child until they're old enough to be counted on to chew them well, which is usually after 4 years of age. There are multiple ways that you can safely introduce peanut products. In the LEAP study, they had babies take Bamba peanut puffs. These are peanut-covered corn sticks that are easily dissolvable. Another great option are the peanut puffs from Puffworks. They have no added sugar and minimal salt. I have links for the Bamba and Puffwork items in the description below if you'd like to check them out. You may dissolve the peanut puffs with some breast milk, formula, or water to soften them if you'd like. However, most babies 6 months and older don't have any trouble taking them as they easily dissolve with their saliva. Since nut butters are sticky and can be dangerous if given in their original form, I recommend you offer the smooth version of peanut butter, either thinned out with water or added to a baby cereal or a fruit or vegetable puree that the baby has had previously. If you're going to be mixing it with water, the peanut butter will thin out quicker with warm water. For every teaspoon of peanut butter, add 1 to 2 teaspoons of water, depending on the consistency that you want. When mixing peanut butter with a baby's cereal or a pureed food, add at least 2 to 3 teaspoons of that food for every teaspoon of peanut butter. You may also mix peanut butter in yogurt, but first be sure to introduce just yogurt to your baby for several days to make sure there's no allergic reaction, since milk is one of the common allergenic foods. As your baby gets older, you may also spread the thinned out peanut butter on a whole grain bread. Most babies do better with the bread toasted and cut into strips about the size of an adult pinky finger or a little thicker. Wheat is also one of the allergenic foods, so first you'll want to introduce it plain. To introduce tree nuts, it's easiest to get the smooth version of almond, cashew, or walnut butter, and just as I described with how you can offer peanut butter, you can also thin out the nut butters with warm water or mix into a vegetable or fruit puree. For an older baby, you can also spread the thinned out nut butter onto strips of toasted whole grain bread. You may be wondering how much peanut and tree nut product you should be giving to your baby and how often. At this time, there are no explicit recommended guidelines for the amount that a baby should take. In addition, the exact amount of the allergen needed to decrease a child's risk for developing an allergy to that food is still unknown. However, the original LEAP study looked at giving 6 grams of peanut protein per week, which translated to 7 Bamba puffs 3 times a week. In the Inquiring About Tolerance or Eat study, they asked parents to give their baby a target of 4 grams of each allergenic food protein per week divided into 2 or 3 meals, and found that early introduction was effective in preventing the development of food allergies. Children who are considered higher risk for developing food allergies stand to benefit greatly from early and frequent exposure to peanut and tree nut in their diet. And even if your child doesn't have any risk factors for food allergies, delayed introduction can increase the risk of becoming allergic to these foods. Therefore, there's no benefit to delaying their introduction. In upcoming years, I believe we will have clear guidelines on exactly how many grams of the allergenic food to give and how many times a week. But in the meantime, you can aim for a target of giving at least 2 grams of the allergenic food protein 2 to 3 times a week. And be sure to continue to expose your baby to them on a weekly basis, since regular exposure is just as important as early introduction for allergy prevention. And even if you aren't able to give as much as I'm recommending, your child stands to benefit from the consistency of being exposed to these allergenic foods in their diet. If you'll be adding peanut butter to your baby's cereal, yogurt, or puree, each teaspoon of peanut butter contains about 1 gram of peanut protein. You can achieve offering 2 grams of peanut protein by mixing 2 teaspoons of peanut butter with one of these foods. If you'll be giving the Puffworks peanut puffs to your baby, each bag contains 2 grams of peanut protein. Or if you'll be giving the Bamba peanut puffs, your baby will get about 2 grams of peanut protein from eating 7 puffs. Try to continue to offer peanut products to your child 2 to 3 meals a week. When it comes to tree nut containing products, Similar to what you would do with peanut butter, you can do with any of the tree nut butters. It's easiest to mix 2 teaspoons into a warm baby cereal, yogurt, or puree at least 2 times a week. I know that parents worry about the potential that an allergic reaction might happen when they offer peanut or tree nut products. In the first video of this series, I go into detail on how an allergic reaction would present itself and what to do in the event that your baby has an allergic reaction. It's linked up here if you'd like to check it out. See you in the next video.